Good day everyone, my name is Brian Marville G. Umayan of BSN3A of Nueva Ecija University of Science and Technology. So for today's demonstration, I will be doing the procedure code COC7 or providing tracheostomy care. So for the ghost, the patient exhibits a tracheostomy tube and site free from venin-aid secretion and skin irritation or breakdown. Then for the equipment, check for bedside table, towel, tracheostomy suction supplies, sterile tracheostomy care kit, sterile cotton tape applicator, sterile tracheostomy dressing, sterile bracing, small sterile brush, small brush, roll-up quill, tracheostomy tie or tracheostomy holder, then scissors, pulse oximeter, stethoscope, clean gloves, mask, goggles or face shield, hydrogen peroxide, and plain NSS or sterile water. So let's proceed for the procedure. For the implementation, bring your necessary equipment to the bedside stand or overhead table. Then for hand hygiene and put on PPE if indicated. Identify the patient and close the curtains around bed and close the door to the room. If possible, determine the need for tracheostomy care. And explain what you are going to do and the reason why the patient, even if the patient does not appear to be alert. Adjust the bed to a comfortable working position and usually elbow height for the caregiver. Lower the side rail closest to you. If the patient is conscious, place him or her on a semi-fallow position, and if the patient is unconscious, place him or her to the lateral position facing you. Move over the bed table close to your work area and raise to the waist height and check for the lung sound. Then place the towel below the trachea site covering the neck and chest of the client.
Gising na po tayo. Papalitan po natin ang silinas natin ng po. Okay lang po ba tayo? Medyo umangat po tayo ng konti. Okay, nasab po tayo dito na.
Place the towel below the trachea site, covering the neck and chest of the client. Put on face shield or goggles and mask. If tracheostomy has been suctioned, remove soiled site dressing and discard before removal of gloves used to perform the suctioning. Then prepare the basins and clean the solution mixture with sterile water and plain NSS and H2O2 in one basin 50-50 or half-half. Be sure it will fill 0.5 inch of the basin and another PNS for another basin that will fill at least half inch. Then perform gravity. the locking mechanism of the inner cannula with your dominant hand and press the tabs and release tab. Then gently remove the inner cannula and place in the the first basin with PNNS and H2O2. Let it submerge for a few minutes.
Ma'am, tatanggalin ko na po.
Then, gently slide the tracheopad dressing downwards and discard the check and exudate the drainage and skin breakdowns or irritation and inflammation.
Ma'am, tatanggalin na po natin ito. Wala naman po makatira.
Then, clean the inner cannula with the tracheo tube using the prepared PNS and H2O2 and use the brush to remove the solidified and sticky mucus. Then rinse. In the second basin, use only PNSS and discard the gloves and you put on another gloves if necessary. Then dry the inner cannula using the sterile gauze and pad and gently reinsert it back to the tracheostomy tube. Be sure it is properly locked. Then use a deep cotton applicator or gauze pad in a cup or basin with sterile saline and clean the stoma under the faceplate. And use applicator or sponge only once moving from the stomata and outward. And pat the skin gently with dry 4x4 gauze pad. Then slide cover sleeve and prepare tracheostomy dressing or perfold cotton filled 4x4-inch dressing under the faceplate. the tracheal collar, you should to be able to put one finger between the neck and collar. Make sure that the patient can flex the neck comfortably and reapply oxygen source if necessary. Remove glove and assist the patient to a comfortable position and raise the bed rail and place the bed in the lowest position. Then remove PPE if used and perform hand hygiene and documentation. Then reassess patient's respiratory status including the respiratory rate, effort, oxygen saturation, and lung sounds.